When it comes to practicing for the critical appraisal, the important thing to recognize is that it's not something that we ever feel that we've got a good handle on, right? So you'll always feel like there's something more to do. And that's okay, because that's the nature of critical appraisal. Similarly, when you actually do the actual exam, very rarely does anyone come out of it thinking, you know what, that was pretty straightforward. Just doesn't happen. Because there is a lot of ambiguity with regards to the questions. There are questions where you're not quite sure about the answer, because that's exactly what real life clinical practice or clinical, the things that we do as well. We're all about, psychiatry is about navigating uncertainty. So what these exams do is they really prepare us to help us think about the options, the uncertainty, about efficacy, about how do we think about, medications when we read a paper. Can we recognize the biases? And that's really what it is. It's about giving us a framework to navigate uncertainty. So it's very unlikely that you're going to come out of the paper with certainty with regards to the answers. But the technique that we're employing is we're focusing on the basics, which is why you have the resources. And all you've got to do is to do those resources at least 2 times, right? And it doesn't mean that you got to do the entire thing, in a very structured manner twice. The majority. So even if you do, I would say even 60, 70% of it, but 2 rounds of it. So there's got to be some rehearsal or repetition and the thinking behind it in random order, then you're in pretty good position to get through the exam. You increase your probability of passing. And as I said, on the second round, you yourself will start recognizing that, I can see the patterns. It's not just about the marks. It's about recognizing the patterns. Because yesterday we saw that, they might ask you about imaging. You might get the answer right. But in the exam, they can ask you what's the differential diagnosis, in which case you've got to be able to narrow down to 1 or 2. Okay. So most of your thinking is going to be about narrowing down. And for critical analysis, that becomes even more important, because we'll see as we go through the questions, right? It's really thinking through each question and kind of going, does this make sense or not? That's why they say, which is the most correct answer, the most appropriate answer? Because there are others which you kind of go, well, yeah, that makes sense, right? But there's one that you'll be kind of, yeah, you know what? That makes complete sense or more sense, right? So that's the strategy for critical analysis. And that's the reason why I recommend that you start off with it, because generally you need that little bit extra cognitive energy, but also a little bit extra time to think through the questions compared to your EMQ.